I just wanted to give you guys an update on Frappachino while she was at the vet and what they said at the vet. So you guys may remember Frappachino from last year. Last year she did lose her calf. It was extremely large. It was upside down in the womb and its legs were tucked back. Instead of coming out feet first, it was coming out nose first. We didn't want to hurt her trying to get the large calf out that was poorly positioned, so we actually loaded her up like immediately, took her to the vet, and the vet was able to remove the baby. Having calves that are poorly positioned, things like that are not uncommon. It was obviously unfortunate that we lost that calf, but we did, think everything was going to be fine, and we went ahead. When she came back into heat, she was rebred like a normal protocol. When the vet came out to preg check her, they felt that her hips felt a little off inside and that they weren't sure that she would be able to successfully pass a large calf if she had another large calf. This was obviously very concerning for us. We want Frappachino to have the best outcome, so we said, what can we do? And they said, be on standby to do a C-section. So since our vet is an hour away, to just all of a sudden be able to do a C-section and get her there, I have lots of worries about that. And of course they did as well. So what we did was we went ahead and we took her 3 weeks before her due date just to kind of have them look at her again. They were saying that during pregnancy, like ligaments loosen, things shift around, so she may feel different now and they have no concerns. Unfortunately, that was not the case. They said if this is a large calf, they still feel that she could struggle to get it out. So the plan for Frappachino is as soon as she starts to get a bag, which means she starts to produce milk, we're going to load her up and take her to the vet. This means that she's within like a window of days to have the baby. Then she'll be able to deliver there. If it's a small baby, she can have it. Normally they'll be watching her. She'll be, like I said, she'll be at the vet clinic. So they're kind of saying that the plan is like, if it's a small baby, she'll be able to have it. If it's a medium baby, maybe it's like an assisted pull. If last case, they will do a C-section. Knowing this now about Frappachino, she will not be bred again. So it's too high risk. It's too high risk for her health. It's too high risk for the baby's health. So she will no longer be bred in the future. Obviously, if we had known this year, it was not something that we knew prior to this. We wouldn't have bred her this year either. She was not AI'd, she was live covered. So it's, it's one of those things that like we're trying to have the best outcome from her. We're going to give her every possible chance to successfully have this baby, and then she just won't have any more after this. So fingers crossed for Frappachino and her baby. Like I said, we'll be checking every day for milk, and as soon as the milk is here, that means, we have a window of time to get her to the vet that day, and then she'll be at the vet for a few days until she actually has the baby, and they will be there to help hands-on medical professionals. If you guys have any questions, feel free to ask them. Honestly, this is our first experience with a cow having a C-section. From what I know about it and what I've researched and what our vet has told us, it is not uncommon for cows to have C-sections. They can actually have multiple C-sections. It's not, I feel like with horses, it's like a last resort, like it's like a life-saving measure, but with cows it's really not. They said it's not that big of a deal, so I was like, well, that makes me feel a lot better. So we are excited for Frappachino, we are excited for her baby, and just fingers crossed that she has a healthy delivery and everything goes smoothly, and then we'll just be taking care of her afterwards.